Many people think that all a pharmacist does is stand behind a counter and administer medication to their customers. Although this may be partly true, pharmacists do much more than that. In order to become a pharmacist, they must go through strenuous years of education in order to pursue this degree. The first step in pursuing this degree, after you get your 4-year degree, you must then go on and take a test called PCAT or PCAT. PCAT stands for Pharmacy College Admissions Test. This test tests you over verbal and quantitative ability as well as chemistry and biology. Once you pass this test, you will then be able to be administered into a graduate school that offers the degree plan you are in. After you take this test, then you go on to take another test called NAPLEX. NAPLEX stands for North American Pharmacy License Test. This test covers your general knowledge of pharmacy. After you pass that test, then you go on to take a state law test, which is over the correct way to handle and dispose of drugs. Another thing that pharmacists turn to is books such as this one that has the list of all the drugs that the pharmacist must know, as well as the laws that the pharmacist must be aware of in order to become a pharmacist. Once you take the test, you then go on and become an intern. The internship can last up to at least 6 months. Once you have passed these tests and become an intern, you then become a pharmacist. When you become a pharmacist, some of the daily duties that you have are, of course, administer prescriptions to customers, fill prescriptions for your customers. You can fill up to 180 prescriptions or more, depending on the size of your pharmacy. Another role a pharmacist has is to counsel patients and teach them the correct way to take the medication as well as how much to take. Pharmacists also deal with insurance companies as well as they keep track of the customer's records in case there is a question on the customer's medical record. A pharmacist's education never stops. Every 2 years, a pharmacist must go back and have 30 hours to continue to be updated on the latest pharmacy laws and drugs and the correct way to administer and dispose of drugs. So as you can see, a pharmacist does not just stand behind a counter and administer drugs. They are fully responsible for the patient's medication, and the patients or customers depend on them very much to not only administer the correct drug to them, but also tell them the correct way to take it and the correct way, the right amount to take. Pharmacists play a big, important role in our daily lives. So as you can see, a pharmacist has the pharmacist has certain duties that are very important to most people, and that is why there is strenuous years of education. So if you want to become a pharmacist, now you know the steps you would have to take to become a pharmacist, as well as the roles you would have when you become one. Thank you.